Dr. John Bianchi is a sports medicine physician with an engineer's mindset and a deep understanding of biomechanics. From high school fields to the New York City Marathon, he helps people recover, move, and excel. Today, we'll meet the doctor who restores active living, not just for athletes, but for anyone who values the freedom to move.
Hi, my name is Dr. John Bianchi. I'm a primary care sports medicine physician, and I work at Total Orthopedics in Brooklyn and Long Island.
You studied biomedical engineering. How did that influence your approach in diagnosing and treating musculoskeletal conditions?
So prior to medical school, my undergraduate training was in biomedical engineering, and I focused a lot on the anatomy and physiology of the human body. I learned a lot about different prosthetics and different types of materials used in a lot of orthopedic procedures and surgeries. And it goes hand in hand with the treatment modalities that we use today in a lot of the orthopedic field.
What aspects of your role here at Total Ortho do you find the most fulfilling?
I love communicating with the patients and talking with the patients. Just seeing how our treatment helps them every day and getting good results. That's probably the most fulfilling part for me. I also love problem solving. So when a patient comes in and they have an injury and they're not sure where it's coming from, I treat it like a journey, and we go down that road together and try to figure out what the problem is together.
So you're also the sports doc or the team physician at Xaverian High School. Can you talk a little bit about that and how you got into that?
So Xaverian High School is something that I hold really close to my heart. I graduated from Xaverian in 2010, and I went on to study biomedical engineering and medicine afterwards. And my goal was always to return to Xaverian and supply great medical care to all their student athletes, which was something that was lacking in the school prior to me graduating and starting working there. I love working with student athletes. I think high school athletes in particular are always very competitive, and they always have a strong will to get back into the game, become healthy again, and treat all different injuries. So I see a wide variety of things, and I love interacting with the student athletes there.
What sports did you play when you attended?
I was a football player, mostly for 4 years. I played a little baseball, a little bit basketball and soccer, but mostly football for all 4 years, especially at the varsity level.
And you didn't go pro? What happened?
I didn't go pro. No. I was more of a nerd, I guess, at the end.
So speaking of sports, and you're living in New York, who is your teams?
Got to go with the Yankees. Yankees and Knicks all day. Some of my New York fans won't like this, but I am a Dallas Cowboy fan. And I'm sorry to all the Giants fans out there that might hate on me, but we could talk about that at the appointment if you like.
What advice do you give young athletes about longevity and staying injury-free beyond high school sports?
So as time goes by, everyone's body kind of responds to Father Time differently. And I think the best thing for young athletes to remember to do is to always keep up with their hydration, keep up with their nutrition, and making sure that they're exercising regularly to be in really the best shape that they could possibly be in. OMT, or sometimes called OMM, stands for osteopathic manual treatment or osteopathic manual manipulation. What osteopathic manual treatment is a physician typically trained as a DO or a doctor of osteopathic medicine has learned skills to help realign the bones and relax the muscles in a way that puts the body in a position for it to naturally heal itself and to make it optimally function. That's the goal of OMT, is to make your body into a position where you function best and let it do what it does naturally without the need of medicines, without the need of needles, injections, surgery. It's a really great treatment for patients that are struggling with chronic pain and want to try other conservative methods that may not have been offered to them in the past, and they want to avoid surgical intervention at all cost. I think it's a great thing to try if that's something that you're looking to do. OMT is something that we do right here in the office. You can make a regular appointment and you could see me in the office, and we do it here. We offer it in our Brooklyn office and our Long Island offices, and I do it multiple times a day for multiple patients.
And what about PRP injections? What's the deal with that? I know you explained it, but
yeah. PRP stands for platelet-rich plasma. Platelets have a lot of healing factors and growth factors and cell signaling factors that tell the body to respond to an injury, and they help signal the body's natural healing response. We inject a highly concentrated dose of platelets into the area of injury for the patient, and it helps regenerate tissue, stimulate new blood vessel growth, and also help with the healing process. This is a great conservative and non-surgical modality for patients to use when they have partial tears or mild arthritis. This is a great way to help with healing for those things. I do that in the office regularly. We just have to make an appointment and we could do it whenever you like.
Having a conservative approach for patients who are either not eligible for surgical intervention or hesitant to do it is great. Can you talk about some other approaches that you have that you can perform in the office?
There's many different conservative approaches when it comes to orthopedic care. Not all of your orthopedic issues have to end in surgery. And there's different things that we could try. And that's my goal, is to try anything that you're willing to try, I'm willing to do for you to help you heal best as possible. We could do things like manual manipulation in the office, trigger point injections where we help relax the muscles, steroid injections where we inject a anti-inflammatory medicine into an area of inflammation that may be bothering you. We could also use gel injections, which help lubricate joints, mostly knees, hips, and shoulders, and even more biologic procedures like PRP, where we use your own body cells to help with healing.
Is there a most common injury that you see?
The most common injury that I treat would probably be neck and back pain. And it's not always related to a specific injury, but it's a chronic condition that I see a lot of patients, especially as we get older, starting to see chronic neck and back pain. This could be related to car accidents, falls, sports injuries, and we see it from children and adults of all ages. There's different ways to treat neck and back pain. We could do injections. We could do manual manipulation. We could do a lot of physical therapy. Referring you to a good physical therapist is sometimes the best thing to do. And also, of course, you keeping up with your own home exercises is a great modality that you could do at home. It's easy. It doesn't cost anything. And usually it's the most effective.
How do I know I'm going to a good physical therapist versus an physical therapist?
So physical therapy, I think the most important thing that you should know about your physical therapist is, are they active in your recovery? Meaning that, are they participating with you and educating you on the proper exercises to do? Are they walking you through how to perform these exercises if they're new to you? And also, do they have a lot of different modalities available to them, like heat and ice and stim and things like that, that can help with your recovery? Some of the not great physical therapists may just throw a hot pack on you and walk away and tell you to ride a bicycle, whereas a good physical therapist will really be more active in your recovery.
How would you say you collaborate with the orthopedic surgeons and other specialists here at Total Orthopedics?
I think collaboration with the orthopedic surgery team here is so important for the overall treatment and care of our patients. By nature, myself, I try to do everything conservative. I try to keep you away from the surgeon as much as possible, as long as you want to. Sometimes that's unavoidable. And I think our surgeons here have a great approach to most treatments that need surgery. It's a great way to communicate the need for surgery to a patient by sending them to a trusted referral source. The surgeons here are readily accessible to me. Whenever I have a question or something that I think may be questionable for any patient, I could pick up the phone at any time and call one of my colleagues and let them know, like, hey, I have patient X and I think a surgery may be indicated for him. Can you double check this? Can you look at that? And it's great to have that second set of eyes overlooking an MRI or doing another physical exam on a patient and confirming what I think.
Can you describe a case where interdisciplinary collaboration significantly improved a patient's outcome?
I think sports medicine is changing every day, and I try to stay as up-to-date as possible by attending conferences and reading as much as possible. The most up-to-date new advancements that I'm aware of would be bone marrow aspiration and MFAT, or microfractionated adipose tissue injections, which are essentially stem cell injections and work very similar to PRP in a way. And it helps regrow tissue and helps healing of new and chronic conditions such as arthritis or tissue tendon tears. And we could do things like that in our Syosset Surgery Center.
Are there any community outreach or educational programs you're involved in to promote musculoskeletal health?
So once in a while, a trusted physical therapy referral source would call me up and ask if I could educate some patients and some of their PTs on different musculoskeletal conditions, things about concussions, things about chronic injuries or new injuries for athletes. So occasionally I will attend conferences at physical therapy offices where I'm able to talk and communicate with physical therapists and build relationships with them, which is great for communicating with the physical therapist when I'm treating a patient together with them.
Doctor, part of being a primary care sports medicine doctor, you do see concussion injuries, and talk about that.
So concussions are huge in sports medicine. We see them all the time in sports medicine. As a sports medicine physician, I act as the quarterback for the concussion care team, and we interact with patients' parents, patients' athletic trainers, their physical therapists, and the rest of the team that will be handling the treatment of the concussion.
So having grown up right here in Brooklyn, where you do see most of your patients, you're here 3 days a week, what is it like now caring for the community you were raised in?
I love Brooklyn. Brooklyn is my heart and soul. I love being here. Being in the community and serving the community means so much to me. I love the fact that I could treat my friends, treat my family members, and treat the rest of the community. Because that's what Brooklyn is. It's really a big family.
What is your favorite local Brooklyn food spot?
My favorite local Brooklyn food, I got to go right down the block with Rollin' Roaster. Best roast beef and cheese you'll ever get.
Would you recommend it post-PT or post-game?
Absolutely. There's been plenty of games where I finished and went right to Rollin' Roaster with the rest of the team to celebrate after a big win. You got to go.
If you weren't a primary care sports medicine physician, what would you be?
I mean, I'm a Brooklyn Italian. I would be in construction somewhere. I don't know.
If a young athlete from Brooklyn came up to you and said, I want to do what you do when I grow up, what would you tell them?
I would tell them this is a very rewarding field, but takes a lot of sacrifice and a lot of hard work. But I wouldn't change it for the world. I love what I do every day, and I would highly recommend it.
Outside of seeing patients here at Total Orthopedics, what are your interests? What are your weekends like?
Outside of orthopedics, my life is very busy. I just had a brand new baby. We have a newborn at home. I have family parties all the time with a big Brooklyn Italian family, so I'm always booked. But I wouldn't have it any other way.
How many family members have you treated since you started practicing in Brooklyn?
I would say it's probably about half of my census every day. I don't know. It's a lot. It's more than a handful. And then it's like family, friends who give me referrals. So it's a lot. I see a lot of family and friends here, which is great.
So Dr. Bianchi, having you done your training in Brooklyn?
Brooklyn and New Jersey.
Okay. What is the craziest injury that you've seen?
The craziest injury I've ever seen was when I was in med school doing my training at a Jersey City Medical Center. There was a patient that was in the ICU after trying to evade the police. He jumped off a roof, ended up breaking both of his legs, and the breaks were so bad that he needed both of them amputated.
And how did you treat the patient?
So as a medical student, we just made sure that he had all his medicine and pain control that he needed throughout the day, and we communicated with the orthopedic team. I was involved in the procedure for performing the amputations, which was very, very interesting, especially as a new med student.
What are some tips you would give a young athlete to keep their body safe while training or playing?
The best advice I have for any young athlete is to know your body. And the only way to do that is to be active and exercise and get experience doing different activities. And if you feel that something is not right, let someone know. Tell a parent, tell a coach, tell your athletic trainer. Let someone know before it gets too late. So when working with young athletes, it's important to remember that pediatric bones aren't just little adult bones. They're different for many reasons. And the main reason is because they're not fully formed yet. One thing that we see a lot in orthopedics, especially working with the pediatric and the adolescent population, is we see growth plate injuries and fractures along these growth plates. And they could sometimes range from very mild to just needing some rest, or sometimes they could be more severe and need casting or even surgery.
What is the youngest patient that you will see?
Being trained in family medicine, I could see anywhere from a newborn to a 99-year-old that I'm actually comfortable seeing. Probably around 7 or 8 years old, depending on, what the injury is. Another common sports injury that we see are ankle injuries or ankle sprains. Usually that happens when there's an inversion injury where the ankle is rolled inwards. You have ligaments that hold that joint together, and it's very commonly injured. The most common one is the ATFL, or the anterior talofibular ligament, or as we like to call it in medical school, the always tears first ligament.
How do you treat that?
Ankle sprains, depending on the severity, can be treated conservatively. Most of the time, it's just resting. We put you in a cam walker boot that you're able to ambulate, and it takes pressure off the ankle. And we just let you do some physical therapy, let you stretch and build up muscle again in that area until most of the swelling has gone away. Being primary care sports, I see the whole body, right? I usually tell patients that I work on heads, shoulders, knees, and toes. And, that being said, sometimes a patient comes in and they're so confident in their injury that they think it's one thing. And then we do some imaging and some exam and we find out that it may be something else. Once I had a patient that came in with some knee pain and he thought it was just some overuse from being a competitive tennis player. We ended up doing an x-ray and there was actually a bony lesion inside of his knee. And we got him set up with the proper care and he ended up being okay. And it was caught early enough to treat him.
See, that's amazing. Had that patient gone to maybe not someone with a primary care background, do you think it's possible that it could have been missed?
It's possible. Yeah. I mean, especially the sports medicine background, learning all the orthopedics, looking at our own x-rays, reviewing our own MRIs. I think that gives me an advantage rather than just seeing your regular primary care doctor. So definitely having that sports medicine training, I think would be really important to see that.
I know you grew up in Brooklyn and you practice in Brooklyn. Mm-hmm. What is your patient experience and population like?
Every day in Brooklyn, it's a new patient experience. Some days I go from speaking Italian to Russian to Spanish all in the same day. I love the diversity of Brooklyn. I love seeing all the different patients and the different cultures. And I think my favorite part would be receiving all the different food gifts that they give me.
It's not just pasta and meatballs.
No. Sometimes I get a nice bottle of vodka, sometimes a nice Russian chocolate, sometimes a nice Spanish food. I love it all.